Welcome. My name is Brenda Scott, and I am a commissioner with the Riverside County Behavioral Health Commission. The Behavioral Health Commission is an advisory body composed of volunteers appointed by the Board of Supervisors, who work in conjunction with the Riverside University Health System Behavioral Health to ensure citizen and professional involvement in all aspects of department services. This video is designed to seek your input as a stakeholder in behavioral health care in Riverside County. Every year, California counties develop planning documents that identify mental health programs and services to be funded by the Mental Health Services Act, also known as MHSA or MHSA, which is a voter-approved proposition from 2004. That proposition was written to include meaningful participation from the community. We encourage everyone to provide input. Your input is valued and important. This video includes speakers who will give you an overview of the Mental Health Services Act plan, highlights, changes, and program goals developed out of stakeholder input just like yours. When this video is posted, it will include a link to the entire draft plan and to the toolkit plan summary materials. You will also find a feedback form that can be completed and submitted electronically. For those wishing to provide oral comments instead, this post also includes an MHSA feedback telephone voicemail number that allows you to leave recorded feedback. The Behavioral Health Commission will ensure that all stakeholders have an opportunity to be heard and that all comments provided electronically or as a voicemail message will be recorded and become a part of the public record. The Behavioral Health Commission will review all the comments and recommend changes to the draft plan, if necessary, based on the comments received. You can also read the comments that others have provided, as they will be transcribed and uploaded to the Riverside University Health System website on a daily basis. You have until June 24th to provide your feedback. I would like to encourage you to provide your input. Your ideas may help to make a difference in how services are provided in our county. We want to thank you for your participation on this Mental Health Services Act plan. Please share this video with anyone you know who cares about mental health programs in Riverside County. Each of the following speakers will introduce themselves before they provide you with their overview. Thank you again for being a part of this important process. Again, your input is valued and needed. Have a wonderful day and be safe and well.
Thank you, Brenda. My name is David Schollen. I'm a clinical therapist and the Mental Health Services Act Administrator for Riverside University Behavioral Health. My job is to ensure Riverside's compliance with the Mental Health Services Act, otherwise known as MHSA, or sometimes we call it MHSA. MHSA was a ballot measure passed by California voters in November 2004 that provided specific funding for public mental health services. The act imposed a 1% taxation on personal income exceeding $1 million. This funding provided for the expansion and transformation of the public mental health service system, with the expectation to achieve results such as a reduction in incarcerations, school failures, unemployment, and homelessness for individuals with severe mental illness. If you have an interest in the public behavioral health care system in Riverside County, you are a stakeholder. An important part of MHSA compliance is ensuring an active stakeholder process where you and people like you can provide feedback on sustaining programs, developing programs, or changing programs in Riverside's MHSA plan. This video will serve as an introduction and orientation to the MHSA plan. This year's plan is a 3-year plan that not only provides an update on plan progress, but also describes a blueprint for the goals over the next 3 years. After you listen to this video, you can click on the links embedded with the post and read about the plan in more detail and how to provide written feedback. You can also give verbal feedback by calling the MHSA feedback voicemail using the phone number also posted with this video. MHSA is only one of the funding streams for Riverside University Health System Behavioral Health, or RUHSBH. The MHSA plan does not represent all of the public behavioral health services in Riverside County, and it is not meant to function as a guide to all services available. Not all services can be funded under the MHSA. MHSA is divided into 5 components, almost like chapters in a book. Each component addresses a different area of the public mental health service system, and each has its own rules and regulations. This video includes updates and planning in each of the components. Briefly, the components are: Community Services and Supports, otherwise known as CSS, is the largest component of the Mental Health Services Act. CSS provides for integrated mental health and support services to children and traditional age youth or young adults, and adults and older adults whose needs are not met by other mental health funds. This includes programs called Full Service Partnerships or FSPs, which are intensive 24/7 service models designed for consumers at highest risk. 50% of CSS funding needs to go to fund full service partnerships. It also funds our clinic expansions. This includes adding people who are peer support specialists, people with lived experience into our service system. It includes adding special evidence-based treatments and increasing program capacity to serve more clients. It also funds our housing and homeless programs, our crisis system of care, and our mental health courts and justice-involved programs. Riverside's work plans in CSS are full service partnership, general service development, outreach engagement, and housing. The next component is prevention and early intervention, also known as PEI. This is the next largest component of MHSA. Its primary goals are to reduce stigma related to seeking services, to reduce discrimination against people with a diagnosis, and prevent the onset of serious mental illness. Additionally, these monies can provide early intervention for people with symptoms for 1 year or less, or who do not meet criteria for a diagnosis. These are low-intensity or short-term interventions. Services for youth under the age of 25 have to represent 51% of the PEI funding. Riverside's work plans include mental health outreach, awareness, and stigma reduction, parent education and support, early intervention for families and schools, a transitional age youth project, first onset for older adults, trauma-exposed services, and services to underserved cultural populations. The next component is workforce education and training, or WET for short. The primary goals of WET are to recruit, retain, and develop the public mental health workforce. Original WET funds were one-time funds that lasted 10 years, but those expired in 2018. We can continue to plan towards workforce development, but those funds need to be from a portion of the CSS dollars. Riverside's work plans include workforce staffing support, training and technical assistance, mental health career pathways, residency and internships, and financial incentives for workforce development. The next component is innovations. It's funded out of CSS and PEI dollars. It's used to create research projects that advance knowledge in the field, not to fill service gaps. These are time-limited plans. They can only last 3 to 5 years. These plans require additional state approval to access the dedicated funds. Our current Riverside work plans include the Transitional Age Youth Drop-In Centers, commercially sexually exploited children mobile field teams, and the Tech Suite, also known as Help at Hand. The last component is capital facilities and technology. The primary goal is to improve the infrastructure of public mental health services. This includes things like buildings and our electronic and information technology. The last capital facilities and technology funds were allocated in 2013 and 14, but a portion of CSS funds can be used to address new work plans. The current work plans include a North Palm Springs adult residential facility with 90 to 100 beds, Riverside's The Place renovation, an Arlington Recovery Community Campus, an RUHS-BH diversion campus, and a Restorative Transformation Center diversion program. Next, I'll provide the highlights and changes report for the CSS work plan. This is the update for community services and supports. In our children's programs, all wraparound programs, these are intensive behavioral health care programs for at-risk youth, were designated as full-service partnerships in fiscal year 1920. This expanded services to Blythe, one of the cities in the desert region. All youth hospital intervention programs, also known as YHIP, these are intensive behavioral health team models for youth and families who have experienced a recent acute psychiatric hospitalization. These teams all became FSPs as of October 1st, 2019. These programs also provide first episode psychosis services for youth ages 14 to 15. Another children's program, Treatment Foster Care, closed effective April 24, 2019, due to a lack of foster care homes to fiscally sustain the program. All staff were reassigned to other programs, and all participating youth and family were linked to alternative mental health services. Blythe Children's Clinic established a memorandum of understanding with the Palo Verde School District for fiscal year 1920 to provide more services to youth on school campuses, a clinical therapist, and a parent partner. A parent partner is a parent with lived experience of caring for a child who has received behavioral health care services within our system, but are now employees, and they're now on school sites 2 times per week, serving all schools, kindergarten through 12th grade, including continuation schools. RUHSBH continues to integrate behavioral health care into Riverside County federally qualified health centers, also known as community health centers, or you may know them as neighborhood clinics. We're doing this integration in every region of Riverside County. This integration allows for behavioral health care for all stages of life, as well as substance use services, to be co-located with primary health care services. Some former freestanding behavioral health programs have moved into these community neighborhood clinics at locations throughout Riverside County. Some updates for our adult and older adult services. In Mecca, the behavioral health clinic will be providing direct care services to adult consumers. This started in March of 2020. The Mid-County adult FSP services were formally contracted out, but that ended in August of 2019, and full service-ship partnership tracks were established in each of the Mid-County clinics, thus reducing barriers for consumers who did not live in close proximity to one of the contracted sites. In just the initial 5 months of the reorganization, an additional 200 new consumers were entered into FSP services. Looking at our older adult services, a smart FSP designed specifically to meet the needs of older adult consumers showed that participants had an 87% overall decrease in admission to hospital emergency rooms for psychiatric reasons after starting the program. SMART programs were successful at engaging 59% of older adult referents who were identified as having both a substance use disorder and a primary mental health disorder into engaging into treatment services. Some updates in our crisis system of care. Riverside University Behavioral Health has a county-wide psychiatric mobile crisis teams that respond to urgent behavioral health care needs in the field and serve in partnership with law enforcement, hospital emergency departments, schools, and foster homes. These teams successfully divert people in crisis away from hospital emergency departments. They decrease patrol police officer time and responses, and reduce incarceration and acute psychiatric hospitalization. In fiscal year 18-19, the crisis teams responded to 2,782 requests and an estimated cost savings of $20 million annually. Riverside also has mental health urgent care centers, and there's one established in each region. These centers provide 24/7 voluntary mental health crisis stabilization, assisting people in their immediate needs and link them to ongoing services, while avoiding more acute levels of care. in fiscal year 18-19, the mental health urgent cares had a total of 11,101 admissions, and the post-treatment surveys indicated that 88% of those consumers reported satisfaction with their care. Some updates in our housing programs. RUH-SBH continued to provide housing and homeless services through our Homeless Housing Opportunities Partnership and Education Program, also known as HOPE. HOPE provides a full continuum of housing and homeless services, including 8 mobile street outreach teams, emergency housing assistance, permanent housing and housing coordination, and housing development. In fiscal year 18-19, HOPE fielded over 7,000 calls for homeless assistance, provided 45,841 bed nights of emergency housing, and 8,388 bed nights of rental assistance. RUH-SBH leveraged more than $19 million in MHSA funds for permanent supportive housing development associated with the creation and planning of more than 850 units of affordable housing throughout Riverside County. The HOPE program, in collaboration with the Riverside County Housing Authority, submitted applications for No Place Like Home housing development funds and were awarded $23.6 million that will create a total of 427 affordable apartment units in Riverside County. Some updates on our mental health court justice-involved programs. We had an expansion of our collaborative courts. Collaborative courts are partnerships between the justice system and behavioral health and includes programs specifically for individuals who are homeless and are justice involved due to crimes related to their homelessness. We call these homeless courts. They're similar to mental health courts, drug courts, and veterans courts. The goal of the homeless court is to provide partnership and resources designed to rehabilitate and integrate individuals back into the greater community. This program is available in Indio, and it has now expanded into the city of Riverside. An additional program is called the Community Behavioral Health Assessment Team, or CBAT for short. This program partners a ride-along RUH-SBH clinical therapist with a patrol police officer. These teams are dispatched to calls related to domestic and behavioral health crises. The program expanded from 2 co-responder law enforcement teams to now a total of 6 teams located within 6 police department jurisdictions: the Riverside Police Department, the Hemet Police Department, the Indio Police Department, Murrieta Police Department, Temecula Police Department, and Moreno Valley Police Department.
Hi, I'm Diana Brown, the Prevention and Early Intervention Manager. The intent of prevention and early intervention is to engage individuals before the development of serious mental illness or serious emotional disturbance, or to alleviate the need for additional or extended mental health treatment. The plan this year is largely the same, but I am going to share some changes and upcoming programming that's coming our way. There are 7 work plans with several programs and services in each. In fiscal year 18-19, 60,624 Riverside County residents were engaged by PEI outreach and service programs. The work plans are mental health outreach, awareness and stigma reduction, parent education and support, early intervention for families and schools, the Transition Age Youth Project, first onset for older adults, trauma-exposed services, and underserved cultural populations. Highlights from fiscal year 18-19 and things to come in the next 3-year plan I will share with you next. 2 of the overarching goals of PEI include mental health awareness and suicide prevention, in addition to the many direct service programs that we're offering in the community. PEI continues to support 29 program providers with monthly contract monitoring for 37 contracts countywide. This includes technical assistance, training, coaching, and support for providers. And in 2019, we began fidelity support, training, and coordination with RUHS behavioral health staff, along with workforce education and training, for the trauma-focused CBT program, Seeking Safety, as well as Triple P. In 2019, 2 PEI programs received the RIVCO Innovates Award, Peace for Kids and Care Pathways. Rivco Innovates is the awards arm of the county's vision for 2030 Eighth Bold Step, Transform Rivco through Efficiencies and Innovation. Its purpose is to promote a culture of innovation that allows the county to deliver outstanding service for its customers and outcomes for our communities at the least cost possible to taxpayers. The goal of Rivco Innovates is to leverage innovative ideas across the county. Congratulations, Peace for Kids and Care Pathways. Last year, PEI released 6 requests for proposals that included the Tay Resiliency Project, cultural brokers building partnerships with cultural communities, the CBT for Late Life Depression Program, Contact for Change, Triple P, and the Native American Project, Strengthening the Circle. In addition to those, we awarded 7 new contracts. First being the Keeping Intergenerational Ties in Ethnic Families, or the KITE program, which went to the Special Service Group. Promotores de Salud Mental y Bienestar went to Visión y Compromiso, and the Mamás y Bebés program went to Riverside Community Health Foundation. We also awarded Community Mental Health Promoters Program for the Asian Pacific Islander group, went to Special Service Group. For the African American population, African American Health Coalition was awarded. LGBTQIA was awarded to Borrego Health, and the Native American population was awarded to Riverside San Bernardino Indian Behavioral Health Institute. Some new programs that will be coming this year include our Native American project, the Strengthening Circle. That RFP is currently in evaluation. And our Building Resilience in African American Families, or BRAF for Girls project. We've had a pilot in place for some time that showed great success. It is now going to be expanded to all 3 regions. An RFP for all 3 regions was released on May 27th. PEI also has plans to purchase 3 recreational vehicles to serve as mobile outreach programs. These mobile programs will visit county neighborhoods, community colleges, community centers, and other similar locations to offer mental health and healthcare screenings that will result in linkage to behavioral health, substance use, and primary healthcare services. Opportunities to stay up to date all year long on PEI-related activities include our quarterly PEI Collaborative, which meets every 5th Wednesday throughout the year, our quarterly newsletter, the PEI Pulse. You can email pei@ruhealth.org to get on the distribution list. We also offer monthly social media posts to RUHS Behavioral Health's Facebook, Instagram, and Twitter accounts. The uptoriverside.org website is full of PEI and countywide information. It's Up to Us Riverside Facebook page is another place to find information for all PEI-related resources and programming. Now, suicide prevention is one of our main efforts through PEI funding, and it includes a variety of activities. In 2019, PEI offered mini grants to implement the Each Mind Matters Suicide Prevention Toolkit during Suicide Prevention Week. We awarded 15 organizations across the county with the purpose to increase Riverside County's capacity to prevent suicide by encouraging individuals to know the signs, find the words to talk to someone they are concerned about, and reach out for resources. We will offer this opportunity again in 2020 during the 2nd week of September, which is Suicide Prevention Week. In the last couple of years, we've worked closely with the Board of Supervisors and received a proclamation recognizing the importance of the 2nd week of September as Suicide Prevention Week. And in 2019, we hosted our first annual Suicide Prevention Awareness Walk in downtown Riverside. Throughout the year, we offer suicide prevention gatekeeper training in the forms of Safe Talk, Assist, Mental Health First Aid, Youth and Adult, and Know the Signs presentations. Over 4,000 helpers in the community have been trained to date. This year, we expanded our training teams and offer these workshops throughout the year, every month. For more information or to register, email us at pei@ruhealth.org. In 2019, we increased our trainers for the Mental Health First Aid, Youth and Adult programs. In addition, PEI has been working on the development of a Riverside County Suicide Prevention Strategic Plan, which will be released in the next couple of weeks. That plan will be put into action through the development of a Suicide Prevention Coalition. We will be developing that coalition in the coming fiscal year. We've also partnered with countywide cultural health ambassadors to provide training, resources, and activities for the workplace. Suicide prevention is also recognized through the efforts of our Send Silence Packing exhibit. In 2019, for the first time ever, we hosted a community event in downtown Riverside with opening ceremony remarks from Board of Supervisor Chuck Washington, the Behavioral Health and Public Health Directors, and a guest speaker, Kevin Briggs. 2 additional exhibits were hosted at Mount San Jacinto College and College of the Desert. In fiscal year 1920, this event was canceled due to COVID, but will be rescheduled when we are permitted. Riverside County also continues to support statewide programming for prevention and early intervention with Each Mind Matters, Know the Signs, and Directing Change. In 2019, the Directing Change local event, which was co-sponsored with San Bernardino Department of Behavioral Health, was held on May 2nd, 2019, with 182 film submissions by almost 700 Riverside County student participants, which resulted in 8 state-level winning films. The other overarching effort that is through prevention and early intervention includes our mental health awareness activities. These awareness activities are done in a variety of ways throughout the county. We, again, work with our statewide partners at Each Mind Matters to use their toolkit to spread awareness about mental health, both in the month of May as well as throughout the rest of the year. Last year, in the month of May, we worked with community-based organizations to provide free toolkits and allow them to work on spreading the word about mental health. And the plan going forward will be to offer mini grants related to mental health awareness to community-based organizations. PEI offers outreach at schools, community events, and health fairs that teaches the community about Each Mind Matters, Know the Signs, PEI programs, and behavioral health services. In 2019, we worked with Active Minds National to offer a summit for local college and university campuses to engage transition-age youth in changing the conversation about mental health on their campus and encouraging them to start their own Active Minds chapters. Other mental health awareness activities include our coordination at the Palm Springs Pride Festival, working with Consumer Affairs, Cultural Competency, Tay Drop-In Centers, and others to spread that information. We also assisted with the coordination and support for faith-based health fairs with the Catholic Diocese and offered a variety of radio and TV interviews on KFrog Channel Q and the City of Riverside Monthly with Mayor Bailey to talk about mental health awareness and suicide prevention. We, in the year 2019, worked closely with the Agua Caliente Clippers to offer a mental health awareness night at a basketball game, and have plans in the coming year to do that again, as well as working with the Lake Elsinore Storm in providing mental health awareness for community members at sporting events. If you have questions or want more information about prevention and early intervention activities and programs, please email pei@ruhealth.org. Thank you.
The Workforce Education and Training component of the Mental Health Services Act was established to address the ongoing workforce development needs for public behavioral health departments. This includes a specific focus on the recruitment, training, and retention of a qualified workforce that is culturally competent and recovery-oriented, that incorporates those with lived experience and includes folks with language and cultural capacities that help meet the needs of our community. The WET team is hard at work to support more than 1,700 employees who serve more than 60,000 people each year. We are using creative strategies every day to help meet the professional development needs of our department, workforce, and the partners in the community. It makes sense to start with our recruitment efforts. These are the things that we do to inspire, promote, and educate and encourage a wide variety of folks to pursue careers in behavioral health today and in the future. These recruitment efforts are so important because California, and especially our region, is facing a significant shortage of qualified folks to serve in the public behavioral health industry. So our recruitment efforts have to be creative and impactful in order to counteract the trends we are facing. To help recruit for the future, we are in classrooms at local high schools and community colleges, inspiring and mentoring students we are supporting, developing and hiring our consumers in recovery to serve in our department. We are offering attractive residency, internship, and volunteer programs to folks interested in behavioral health. And we are bringing in as many financial incentives like student loan repayment programs as possible. When we bring people into our workforce, We also want to make sure that they have the tools they need to be successful. That's why training remains a top priority for our department. Each year, we gather data to help us understand the current and emergent needs of our consumers and the trends in the public behavioral health industry, both locally and nationally. Armed with this information, we develop strategic training plans to help our workforce stay prepared to serve. For example, we've had more people come to us needing help with challenges like eating disorders, complex trauma, and changing patterns of substance abuse. In response, we brought in cutting-edge trainings for hundreds of staff to address these challenges so that they would have the knowledge and skills they needed to respond compassionately and effectively. These efforts included specialized substance use trainings through UCLA, trauma trainings from state experts, and partnerships with evidence-based practice leaders in treating eating disorders. But our training efforts aren't just limited to our department staff. We know that it takes all of us, the whole community, to heal ourselves. So we continued to expand our training and professional development efforts to include more opportunities for the community members to train with our agency, to access information, and to offer trainings and information in formats that were more accessible, more economical, and more responsive to our rapidly changing needs. We expanded our presence on social media, promoted digital tools filled with useful information and resources, and significantly expanded our suicide prevention gatekeeper trainings like Safe Talk, Assist, and mental health first aid. Social media and websites are one of those strategies for helping our community stay connected, informed, and increasing the ease of access to our services. Since we rolled out our social media strategy in 2016, we have connected to over 800,000 households across Riverside and neighboring counties through Facebook, YouTube, Snapchat, Twitter, and Instagram. More than 1,000 people have seen our social media content and have actually connected directly with resources or services. In the past year, we have seen over a 450% increase in social media traffic and a 115% increase in people who subscribe or follow our content over the prior year. Our social media accounts have more than doubled the traffic as compared with other partner agencies in our own county in just half the time. All of this data tells us that we are connecting to our community like never before. Finally, let's talk about retention. Along with training professionals to be good stewards of service, most of us can agree that it's also important to have a good working relationship with the professionals in our lives. So we place special attention and efforts on the retention of our qualified caring staff. One creative way we are doing this is by paying attention to staff morale. When staff feel appreciated and their hard work is recognized, they are more likely to feel good about the work that they do and more likely to stay employed with this agency. This, in turn, creates opportunities for staff and consumers to build trusting, dependable working relationships, a win-win for everyone. Over the past 3 years, we've continued to improve upon a staff recognition and appreciation program to help achieve this goal. The program includes active participation in a system-wide Employee Appreciation Week, the creation of an online portal for staff to recognize one another, and upcoming toolkits with effective strategies for work sites to recognize and appreciate their staff year-round. This past year, we were able to include live presentations of awardees at important events like our monthly Behavioral Health Commission, and we also included videos and banners on our websites honoring awardees. Another great way to strengthen morale and to inspire long-term career development in the agency is to offer staff a variety of financial supports and incentives that help them gain new professional skills and knowledge and help them pursue promotional opportunities. One of our most successful efforts in this area is our tuition reimbursement program. This program is designed to reimburse tuition costs for employees pursuing certificates, degrees, or individual coursework that helps create promotional opportunities in the department or that would increase the employee's knowledge and skills in their current position. Since 2013, we have supported over 90 employees by issuing over $500,000 in tuition reimbursement. Staff have pursued a range of degrees and certificates, from advanced degrees to become therapists, to certificates to become certified accountants, to coursework to strengthen their own office management skills. Other financial incentives that support staff retention include our generous 2020 program, which supports staff pursuing master's degrees in clinical practice, and also includes our ongoing efforts to create as many eligibility opportunities for staff to access federal loan repayment programs. These are just a few highlights from the past year. All of our projects are a part of a concerted effort towards ensuring a qualified and caring workforce for today and the future. Thank you.
Hi, I'm Mariah Andrews. What is the innovation component? The MHSA innovation component works like a large research project. Projects must be designed to advance knowledge in the field of public mental health. The innovation component was not designed to meet service gaps. It is funded through a specific formula using money out of the CSS and PEI components, but requires an additional state approval process to access those funds. Plans are time limited and can only last 3 to 5 years. Riverside currently has 3 innovations projects in progress. Our TAY one-stop drop-in centers, our CSEC or Resilient Brave Youth project, and the Tech Suite project. Our transitional age youth or TAY drop-in centers operate in a non-traditional model, providing outreach, support, and behavioral health care in a youth-inspired space. TAY consumers have reported that they enjoy having their own place in an environment that feels like home and feels safe to explore their developmental and behavioral health needs. The drop-in center model allows any TAY challenged by mood, thinking, or behavior to access support regardless of mental health history or reason for seeking care. Each TAY center provides a variety of services, activities, and events. Youth access mental health assessments, individual and group therapies, psychiatry, mental health rehabilitative services, case management, collateral and services with family members, and evidence-based practices such as first episode psychosis, eating disorder treatments, and trauma-focused CBT. 1,235 unduplicated youth received services at the TAY centers in fiscal year 2018 to 2019. Compare that to only 475 youth served in fiscal year 2017 to 2018. The TAY centers also served as a resource hub for agencies and organizations that serve youth so that referrals could be coordinated on the spot with visiting representatives. Each region hosts a TAY collaborative meeting with the purpose of sharing resources and collaborating with other programs. Examples of organizations attending the monthly TAY collaboratives include faith-based organizations, Inland Empire Health Plan, North County Health Systems, RAP, MHSA Prevention and Early Intervention, Department of Public and Social Services, Hope Housing, Victor Community Support Services, and neighborhood clinics. The TAY Center plan also included the development of a TAY Peer Support Specialist training curriculum. From July 2018 through June 2019, 2 TAY Support Specialist trainings were held with a total of 26 trainees attending and 22 graduating. These 2 trainings were held in the Mid-County region. This is the final year of the 5-year plan. Due to the success of the project, starting with fiscal year 2020 to 2021, The centers will integrate into the community services and support component for continued funding. Our next project is our Commercially Sexually Exploited Children, or CSEC, Field Response Team. This program combines an adapted trauma-focused cognitive behavioral therapy model to effectively treat trauma with a mobile, field-based, intensive approach. Youth who have been commercially sexually exploited, more commonly known as human sex trafficking, are often difficult to reach and serve based upon the high risk associated with their exploitation. This program model is delivered within a coordinated care team model of peer support specialists, behavioral health specialists, and parent partners to improve outcomes for treatment. Since its inception of this project, the program provided training to the community at large on human trafficking, allowing further assistance in identifying youth that could be at risk. CSEC expanded its target population served to include youth who were at risk for exploitation in order to provide services as a form of prevention and to empower youth and their families to recognize warning signs. This is the third year of a 5-year plan. This program continues to grow with added partnerships and collaboration to gain more referrals and to offer more resources to at-risk youths and their families. And the Tech Suite projects, or the Technology Suite project as we call it, this project is in collaboration with 13 other California counties to bring personal technology into the public mental health services system using a set of innovative smartphone and computer applications designed to support the recovery continuum from engagement to treatment to wellness maintenance. Tech Suite, or the Help at Hand project, as it is now called by the county partnership, began in March of 2019 for Riverside County and was extended to a 5-year project timeline. Our early implementation of this plan has included developing educational materials on the use of technology apps for recovery, while apps that would best meet the goals of the partnership and the unique needs of Riverside County were explored. Apps first identified by the early adopters of this multi-county partnership did not prove to be aligned with the overall project goals, and the partnership opened up the opportunity for new vendors to demonstrate apps that supported the initial intent of the plan. These goals included technology that would help the user identify early signs and symptoms of mental health challenges, improve early identification of emotional behavioral challenges, to inform a user of wellness strategies, and connect individuals seeking help in real time, and increase user access to mental health services when discomfort or remote locations provided barriers to linkage. RUHS Behavioral Health has created our own peer support chat app called Take My Hand. The app allows users to receive peer support in real time, similar to a helpline. We have done some early testing of this app due to the COVID-19 response in order to provide services remotely. RUHS Behavioral Health will work with the Tech Suite County Partnership on completing an official pilot of our Take My Hand app once our current trial period is over. The Tech Suite team has been working hard to also determine other apps that will be piloted in our county and continue to add more technology to meet the goals of this project. Thank you.
Hi, it's David again. And here I'm here to talk to you about the Capital Facilities and Technology component as it's written in the current MHSA plan. Our first project is the North Palm Springs Adult Residential Facility that will be known as Roy's Behavioral Health Oasis. The department is in the final stages of the homeless shelter conversion into a large adult residential facility with a 90 to 100 bed capacity. This facility is located in North Palm Springs in a commercial building complex that also houses an outpatient FSP program, 24/7 homeless drop-in center, and permanent supportive housing. The project will establish a licensed augmented residential care facility. The facility will include 45 to 50 bedrooms, an indoor-outdoor activity area, a common living area, and restrooms, showers, laundry facilities, a commercial kitchen and dining room, staff offices, and meeting rooms. It will serve approximately 90 to 100 individual adults per day. The facility is scheduled to open in the fourth quarter of 2020. The next project is the Riverside Arlington Recovery Community, also known as ARC. The department has identified a need to establish community-based programs that can effectively engage and serve individuals who have had contact with the criminal justice system and whose contact is related to an untreated or ineffectively treated mental health or substance use disorder. The ARC program will provide a fully integrated residential and outpatient approach to treating serious mental health and substance use disorders with the purpose of diversion from incarceration and correctional facilities, reducing recidivism, and engaging individuals in restorative justice activities. Integrated care will provide residential and intensive outpatient treatment, case management, and physical health care. The planned 54-bed facility will be located in the city of Riverside. The community will also have a sobering center to serve individuals with acute substance intoxication who do not meet the necessity of medical intervention and can be stabilized over a brief period. The sobering center will have the capacity to treat 15 people at any given time for an anticipated annual average of 1,825 consumers. The next project is the Riverside Homeless Safe Haven renovation, known as The Place. The Place is located in the city of Riverside. It opened in 2007 and provides permanent housing for 25 adults, as well as supportive services, laundering and showering facilities, meals, referrals, and fellowship for drop-in center engagement. The drop-in center Safe Haven operates all year long, 24 hours a day, 7 days a week, and serves as a portal of entry for hard-to-engage homeless individuals with a serious mental health disorder. Safe Haven had 6,522 total visits in fiscal year 18-19. The permanent housing component operated at above 100% occupancy over the course of the year. Overall, more than 91% of residents of the place maintain stable housing for 1 year or longer. The place is now 13 years old. The population served has changed over time. This remodel will also add clinical space to provide more on-site mental health and substance use disorder treatment services. The department is working in cooperation with the City of Riverside to renovate and modernize this leased facility. The next project is the Riverside University Health System Behavioral Health Diversion Campus. The RUHS Behavioral Health Diversion Campus programs will serve consumers facing homelessness who have been justice involved due to a lower level offense and who have a moderate behavioral health disorder. The diversion campus participants would have access to residential services, full service partnerships, and intensive outpatient treatment, including safe, drug-free housing for the entire duration of the consumer's stay. The purpose is to provide these consumers with needed treatment to improve care, reduce recidivism, and preserve public safety in conjunction with county public safety partners. The next project is the Restorative Transformation Center Diversion Program. The Restorative Transformation Center will be a 30-bed facility used to deliver social rehabilitation services to two distinct populations. The first population is individuals charged with an offense in Riverside County who would benefit from a pre-trial mental health diversion program. The program anticipates serving an average of 60 consumers per year. Program participants are individuals with a serious mental illness who have committed certain felony crimes and are found by the court to be incompetent to stand trial due to their mental illness. The mission of the program is to provide intensive community-based psychiatric treatment so that instead of remaining in custody and waiting for a transfer to a state hospital for competency restoration, the individuals will transfer to a residential behavioral health treatment program instead. The ultimate purpose of this program is not competency restoration for adjudication, but rather for long-term psychiatric stabilization. The second population served is adult consumers that need treatment services but are unable to care for themselves independently, but can be cared for in a social rehabilitation program that provides psychiatric care in a normal home environment. This includes a high level of care, stringent staff requirements, 24-hour-a-day, 7-day-a-week supervision, and treatment assistance and community participation at all levels. This program's services include intensive diagnostic evaluation, full day treatment program with an active pre-vocational and vocational component, special education services, and outreach and linkage to the general social service system and skill development therapies to assist moving forward towards living in a less structured setting. Thank you.